I found myself the other day starting to research what goods and what food is made in China, in Italy, what's imported here that we need to be concerned with. And it started to spark, I know it's like a very extreme way to look at things at this point, but it started making me realize that this is something that's concerning me. I don't know how to prepare. I'm somebody who likes to be prepared. I'm a producer and I'm a think-aheader. And so we wanted a professional to come onto the show, A, to let us know how worried do we need to be, and B, how do we prepare? Because we talk about on the show here all the time, when we know better, we do better.
That's a great model, and I'm happy to help with that. So I'm really happy to answer any of your questions. This is a quickly developing, quickly evolving situation, which I think is important to point out because we only found out about this novel coronavirus, COVID-19. It only started appearing a few months ago. And so there is a lot that we don't know, but there is a lot that we know already. And so I'm happy to talk about those things.
So what do we know about this virus and how it's transmitted?
So this is a coronavirus. I'm going to refer to it interchangeably as COVID-19, which is the specific name for it, and as coronavirus, because that's how many people know it as. But this is one of several types of coronaviruses. It's not the only coronavirus. Actually, a few of the types of coronavirus that are very common cause the cold and are part of just what already exists. So coronavirus, COVID-19, is a respiratory illness. So think about it the same way that we might think about influenza, the flu. So someone who is sick with the flu, they cough, they sneeze, you're standing close to them. And I know this sounds a little bit gross, but the droplets that you are sneezing and coughing land in that person's face, and they end up getting sick as a result. Now, some other ways that people could get it, you could cough and sneeze into your hand and then shake someone else's hand. Or you cough and sneeze, you touch your face, and then you touch a mug and then give that mug to someone else, and they might get it that way as well. So know that it's caused by the respiratory route. Again, think of it as the cold or the flu. And it's important to note that it cannot be transmitted, as far as we know, through food or through items that are made in other countries. And so you were mentioning at the beginning of the show about goods that were produced in other countries. Even though this novel coronavirus can live on surfaces, by the time that an object is shipped from one country to another, I've also gotten questions about mail, about can you get it from opening the mail from other places?
Yeah.
It's extremely unlikely that that would happen. The respiratory route, standing close to someone who has the virus, or again, sneezing into your hand and shaking someone's hand, those are the most common routes. And that's why the best things that we can do to prevent us each from getting coronavirus is the same thing that we would do in flu and cold season, which is wash your hands more and touch your face less. So the average person touches their face many times in a single minute. And so practice touching your face less and wash your hands with warm water and soap for at least 20 to 30 seconds. Stay home if you're sick. Avoid others who may be sick themselves, and just take good common sense precautions.
So I heard that you have to wash your hands the length of singing happy birthday twice. That's extreme, is it not?
It feels like a long time. But then again, people are talking about, I mean, I've seen the questions that are popping up on the internet. I hear the questions from my patients, and people are thinking about much more extreme measures. And we're talking about hand washing.
Yeah.
Sometimes the simplest precautions can make the biggest difference.
So should we be wearing masks? Should we be wearing gloves? Should we be avoiding shaking hands? I'm shocked people still want to shake my hand. I'm always like looking at them like, please don't, please don't.
Well, this is a really good question, and I'm getting questions about masks all the time, as I'm sure you are as well. The answer is that the everyday person should not be wearing masks, should not be going to stores and stocking up on masks. Here's who should be wearing masks. Healthcare workers should be wearing masks, and a particular type of mask. And the reason is that they are directly exposed to people who are coughing and sneezing into their face.
Hmm.
They may be performing procedures on people who are spewing respiratory droplets. And it is really important for healthcare workers to be wearing appropriate precaution, this particular type of mask called the N95 mask. But it's not useful to the everyday person. And in fact, it's counterintuitive as to why, but here's why. Most people are not used to wearing masks,
Hmm.
and you may end up adjusting your face a lot more. And that's actually what could spread what could spread this virus. The other reason too is wearing a mask may give you a false sense of security, when in fact a lot of the masks that are mass produced are not that helpful for protecting you in the first place. So do not go out and stock up on masks. In fact, do what public health experts and doctors know to be the most effective, which is wash hands more and touch face less.
Hmm. So the president has said that they are working with pharmaceutical companies to come up with a vaccine quickly. Do you think that that will happen quick enough to help us?
Well, developing a vaccine is important, but it's not going to happen anytime soon.
Yeah.
The best estimates that we have for developing a vaccine are on the order of 12 to 18 months, which is already very fast by vaccine development standards. But a vaccine is meant to prevent you from getting an illness. That's why when you get the flu vaccine or the measles vaccine, it prevents you from getting those particular diseases.
Hmm.
If we don't have a vaccine anytime soon, we should look at other methods of preventing this illness. And that includes washing hands, not touching your face, avoiding going out when you're sick, coughing and sneezing into your sleeve instead of out into the open. And you were asking about handshakes too. There is an argument to be made in flu season, just like now. Maybe it's time to reduce the handshaking and the kissing on the side of the face for now.
Yeah.
And the elbow bump is a good public health measure to take in the
Yeah.
meantime.
I do the elbow bump as much as I can, but sometimes they get me too quickly. Um, Question about airplane and air travel. Should we be limiting our air travel right now?
Yeah, this is a good question and a difficult one to answer for a couple of reasons. One is that this is such a quickly developing situation. Just a couple of days ago, the US announced new travel guidance and new travel restrictions to certain parts of the world. And that could change as there are outbreaks arising in other parts of the world, as there are outbreaks that are controlled in parts, the travel guidance from the US government could change. And I certainly would advise for everyone to heed that travel guidance when making their own plans and to keep on checking back because things are changing and evolving very quickly. Now, planes in general are the air on the plane is safe. I've been asked this question too about, well, what about breathing the air? You're not going to get coronavirus or another respiratory illness if you're seated in row 10 and somebody in row 50 has the illness. It's not a question of circulated air. But a plane is a closed and relatively confined space where you are sitting close to other people. So if the person sitting next to you or in front of you or behind you is ill and they're coughing and sneezing, you could certainly get sick that way. And so it is a question that you have to ask yourself about your own need to travel at this time, your own risk tolerance, and certainly when it comes to travel to specific parts of the world, make sure that you check the travel guidance. The best place to get that information is from the Centers for Disease Control and Prevention at www.cdc.gov.
Yeah, I heard that the people who are most at risk are the elderly and, of course, anyone who is sick. So
Mhm.
if you are relatively healthy, they say that, it's something that you could contract and get rid of very easily. Is that true?
Again, I want to stress that this is a relatively new illness. And
Hmm.
so I will tell you what we know based on the existing information, but this could change. What we know so far with the cases that have been reported in other countries, particularly in China, where there were tens of thousands of cases, there have been tens of thousands of cases. What we know is that this new coronavirus, COVID-19, seems to particularly be severe for older people and people with underlying medical conditions. So far, it does not appear to be the most severe for young people or children or other people who are relatively healthy. And what we know too is about 80% of people who get this illness have mild illnesses. They can recover at home. It may be similar to them for a cold. And in fact, some people who have COVID-19 may not even know that they have it. They may have such mild symptoms or no symptoms at all.
Hmm.
But about 20% of people who get it will get very sick. And at least those are the numbers that we know so far. And so those individuals will require hospitalization. Some people will require being put on ventilators, and a small proportion of those individuals will die. So far, the death rate looks like it's about 2%. And so I say all of this because, yes, it is true that the individuals who get the sickest are those who are the most vulnerable because of underlying chronic ongoing medical problems and who are older. But there have also been cases of relatively young people who have gotten ill and have died too.
Yeah.
So it's something that we really should watch carefully, the same way that we would watch something like the flu as well.
So should we be supplementing ourselves with, vitamin C and such to keep our immune system strong to combat?
It is important for us to keep our immunity strong. The evidence about different herbal alternative medications it's not necessarily scientifically evidence based, but there are things that we can each do to keep ourselves healthy: regular exercise, eating well, and importantly, avoiding areas where there are individuals who are ill,
Hmm.
and taking precautions into our own hands that way too. If we are sick and maybe we have a cold, maybe we have the flu, we should be staying at home and not spreading it to others too.
Yeah. What advice do you have for parents right now who have kids who are going to school? And then also, I mean, what if the kids are sick? Now you're taking them to the doctors and hospitals where other people who are infected could be there. How do you handle all of this?
Well, first, the good news about COVID-19 and children is that it appears that even though children have been infected in other countries with coronavirus, they have not been extremely ill. This does not appear to be something that particularly affects children, which is good news. Um, right now, what parents should do is continue to do as you normally would in cold and flu season, as in, if your child is sick, you probably should not be sending them to school anyway. You should call your doctor before you go into the doctor's office, because maybe you could avoid a trip to the doctor's office or to the hospital. And you should try to avoid other people around you who are ill as well. One more thing to do that is particularly important right now. A lot has happened even in the last week with coronavirus, with new cases that have just been discovered in New York, Rhode Island, Illinois, up and down the West Coast in California, Oregon, Washington State. There might be more cases. In fact, there will be more cases as we do more testing here in the US. And already, school districts and schools have closed out of an abundance of caution. So, something that parents could do for those with school age kids is to think about a plan. If your kid's school is going to be closed, can you also telecommute? What other things can you do to keep your kids occupied in this time? This is a good time for everyone to start about their own preparation when it comes to their own lives, and thinking about your telecommuting plans, how to take care of your children and those who are elderly, is important too.
Yeah, well, I was thinking about it in terms of my parents who are my kids. My mom has brain cancer, my dad is diabetic. So I'm trying to now move forward with getting extra medications for them so I have a supply. God forbid something was to happen. Is that overreacting?
Not at all. That is a very good common sense precaution to be taking, that everyone should have a 30-day supply of their medications anyway. That's what we should be doing anyway for any emergency. This is also one way to think about this, that coronavirus or any kind of disease outbreak is one particular type of emergency. But imagine if we're also preparing for a bad winter storm, or a hurricane. There's also a disaster preparedness plan for that too. And in all of these situations, it's smart to have a
Mhm.
supply of medications in case you can't go outside or in case the pharmacies are closed. And I would certainly encourage for people to have on hand at least a week's worth of food supplies and potable water that they can keep so that if you're told to try to stay at home, you can stay at home and have those supplies at the ready as well.
Dr. Wen, I know you're very tight on time. I have one last question for you. When you think of all of the other pandemic situations, the SARS, the
Zika.
Zika, the Ebola, all of these different massive issues we've had in our world, where does Corona stack up? And do you feel like it will be something similar to those where it will be quickly handled, I guess?
At the moment, we just don't know. SARS ended up being able to be contained. And the other illnesses that you mentioned are different in different ways because they have different ways that that they are transmitted, and they affect different populations. So I think it's hard for us to compare to the other illnesses, the other epidemics in the past. What is important to say is that for coronavirus, it is quickly evolving. It does appear to be something that's highly transmittable, meaning that it is contagious, very contagious, and affects. It looks like so far one person who has the illness will affect 2 to 3 other people. It also is something that causes mild or no symptoms, which on the one hand is good because some people will recover without any incident and may not even have any symptoms. But on the other hand, makes testing very challenging because someone could well be in the community and spreading it to others
Mm.
without knowing that they have the illness in the first place. So this is quickly evolving, and we have to be vigilant and follow the advice of our local public health officials because things are changing very quickly.
Yeah, that's what I saw in the news this morning. A couple people were tested twice. They were told they did not have it. They were retested again and they did have it. And now there's like an entire blame game going on. So it's scary to think that people could get a clearance, go home to somebody who is vulnerable, and now it just spreads from there. It seems like we don't really have a good handle on it yet.
Well, and also I think for testing, it's possible that when they got tested the first time, it was so early in the incubation period, which is the period between when someone first is exposed and when they end up developing that illness. So if they got tested very early in that period,
Mm.
it's possible that the test will be negative. But that's not the fault of the test or the person who did the test. It's just a question of disease progression, the same way that it is for any other illness. I do think the US needs to do a lot better with providing a lot more tests so that doctors, patients, so that people can have access to testing. But again, this is a relatively new illness, and we all have to do our part to prepare for it.
Dr. Wen, thank you so much for taking the time. I know you have a crazy schedule, and we look forward to having you in studio for a longer episode on a whole other topic, which I'm very passionate about as well, based on your book, When Doctors Don't Listen. So thank you so much.
Thank you very much.